Okay, and joining us after a little lunch break here at the CHNC Symposium, we have Morgan Kowalski and Malathi Balasundaram.
You got
I
it.
got it. Yes. Okay. Wow, a power duo. Okay, of a clinician who is just a fierce advocate for family-centered care, a former NICU parent who has just committed herself to the cause. You guys have done tremendous work as the leaders of the Family-Centered Care Task Force, which is now almost celebrating its fourth birthday. Is that right?
That's right.
Okay.
Yeah, almost fourth birthday.
Wow,
It's
amazing.
crazy.
Time has flown. And I mean, you guys have grown the FCC task force from just a handful of people to a huge international collaborative now. That is absolutely incredible. And today you're hosting a workshop entitled Development of a NICU and NICU Follow-up Clinic Family Partnership Council: Impact on the NICU Experience and Follow-Through Care. So obviously you guys provide education around the year round, which we'll get to. But tell us what the goals of the workshop are.
Yeah. I just wanted to emphasize this is the workshop that CHNC focus group is
Mm,
doing it, and we are invited to be part of that focus group, and we are leading, and then we are co-leading with the focus group
love
and
that.
improve the Family Partnership Council establishment, both the NICU and as well as the follow-up clinic.
I love that.
So we are putting together workshop, 2 hours workshop, and we are going to talk about Family Partnership Council and what are the barriers that you guys face and how do you overcome those barriers. And so you have to look into this. I'm using the Family Partnership Council, and we used to call Family Advisory Council. So we are moving away from that advisory role to active partnership. So that's why we have changed the terminology to Family Partnership Council.
I love that. Before you go any farther, I recognize here we're familiar with the concept, but I think maybe some people aren't familiar with the concept. So let's talk, just wind it up a little bit about what is a family partnership council.
So, a family partnership council is a group of ideally multidisciplinary clinicians and family partners diverse in their lived experiences and backgrounds.
Mm,
So, ideally, you've got bereaved parents, parents of extremely preterm infants, late preterm infants, term infants, maybe special diagnoses like
mm,
HIE, NEC. And there's even room, I think, for grandparents and other
I
kinds
love
of
that.
caregivers on
That's why we
this.
have a name family. We
That's
didn't call the
right.
parent, and we are just including the grandparents and aunt, uncle, anybody can.
Siblings.
Yes, siblings.
So ideally, this group, instead of coming in at the tail end when the NICU team has created a guideline or a policy or is completing, quality improvement work, instead of having a family come in at the end and say, "What's your feedback on this?"
Mm,
We are encouraging folks to actively partner with them at the inception of the project or the policy creation or the guideline creation so that families aren't in this kind of advisor feedback role. It's more of a like a co-leadership, a
mhm.
co-partnering of families and clinicians to ensure that everything's family centered from the start.
I think that's so interesting. I mean, not just because families are basically the ultimate stakeholders of all of the things we do, but I anticipate it would actually save us time in the long run, because I
Yes.
can only imagine how many times we take things to families
Mm.
and they're like, actually, you missed the mark on this.
Yes, I'm thinking specifically of an instance in my local NICU where I had a nurse. She had worked so incredibly hard
Mm,
on the visitation policy for our NICU. She really wanted to update it,
we're
make
not
it more
calling it that anymore.
Yes.
exactly, which I think she would have I think she would have known if she had included me from the outset.
Mm,
But since she brought the policy to me after it was already created, there was a lot of effort that was put into going back and changing all of the language from visitor policy to presence policy, right? And I think that why would she think that the word visitor was maybe not a totally empowering term? I mean, she was just trying to update the policy to make it better.
Right.
And
And
we
she
probably have
did.
people listening who are still a little confused. So why is it not the most empowering
Yeah, why
term
does
for
that word change
families?
matter?
Well, when parents are empowered to be at the bedside as frequently as they can be, their infants experience better clinical
Mm,
outcomes. shorter stays, lower mortality rates, fewer readmissions, the family well-being increases, family and parent satisfaction increases. There's a lot of evidence pointing to donations from individual families coming in at higher levels
wow.
when
Believe
we've got
that.
increased parent presence and things are reflective of that kind of culture. And when you call a parent a visitor, it makes us feel like we've got even less agency over our kids than we already have, right? Like we already have to rely on healthcare professionals to do the things that need to be done to keep our kids safe and alive and healthy. And so for us to not have access to them whenever we want or whenever we can is hard.
Yeah.
And so I think the shift to presence is it's huge.
Yeah, and that term visitor implies like this is your baby's home right now, right? And it implies that you're not
You're an
permanent.
outsider.
Yeah.
Exactly.
Well, I've learned so much actually through the family centered care webinars about just how important. I mean, semantics matter. The words we use, the terminology changes the whole experience, and that was such an excellent point. So now we know we're not going to call them visitors. We need them to be engaged. Now these are discharged parents sometime after usually the NICU admission, who are now engaged in policy making in individual NICUs.
That's
So
right.
what are the barriers?
To creating the Family Partnership Council. Yeah. Welcome to our workshop. You're going to learn more about it. And we actually did the small group collaborative as a part of the FCC task force. And Daphna, you are one of the co-leader for that small group. So we found out it's like we gave them the list of barriers and everyone checked off every single one of them.
Yeah.
So the all barriers were the top barriers in our Pareto chart. Like
Give us
Lack of staff time,
Yep.
lack of family availability, lack of scheduling
they-
meeting times.
clinicians don't even know how to recruit the families. That's the first barriers, and they don't know how to run a meeting and how do I schedule and how do I make sure they are engaged. And so
What are
there
the
is what are the goals? And then families like we can commit to it, and there is no financial was a
That's such an important
barrier,
part of this.
because they are not getting any compensation, and if you are not providing a compensation, then you are recruiting only privileged people to be part of the council, so you are not diversifying your group. So those are all the barriers, and then we just need to look into that, and then building the council, it's not going to be perfect in the beginning. It's a progress. So you start with that and then get to that goal of like perfection later on. So that's what we are going to show in this workshop.
I love that. So do you offer any solutions to some of these major barriers?
Yes, and we have a few centers and they actually did this in an amazing way. So we are going to show that example, and we are going to actually do the small group setting and ask them, okay, so how do you rectify this? And we are going to give them a financial, like example financial, how do you, so you reach out to your foundation team, share your family stories. And so just to help them to have the fundraising or some aspect. So the foundation team, that's how I was able to build in my local NICU. So reaching out to the foundation team and I share them and how we are doing, and even a small win. Like if you are, if you did something like a publication or you took your nursing staff or family collaborator, you went and presented somewhere, share that information with your foundation team, C-suites and leadership team, get them buy-in, marketing team, and get them buy-in. Okay, so something great happening in the NICU. Let's go and then see how we can support further.
And you didn't mention this, but it sounds like one of the best ways, if you're really at the ground level for creating your family partnership council, then they should at least be tuning in to what you guys are doing through the
Yes.
Family Centered Care Task Force. So tell us what sorts of education do you provide? How can people get engaged?
Yeah, so Family Centered Care Task Force, when they started this 3 years ago, it's just a kind of like a bring all the passionate people together. And Daphna, you are one of the founding member of this task force. So we just put together the educational webinars, so creating the awareness. I just connected with the clinician this morning and he wasn't aware of the family-centered care.
Right.
What are you talking about family-centered care? We do family-centered care. They do skin-to-skin care.
Right.
Skin-to-skin care alone is not a family-centered care.
That's
Yeah.
right.
Just a
So,
component.
yeah. Exactly. So they don't know. So how do we create the awareness and how do we take this to the frontline providers? That's why we have this bi-monthly webinars. So we just invite the scientists and researchers to talk about why we need to do it. And also we invite the family partners to share their lived experience. So it's a collaboration of a family partners and clinician to have this educational webinar. We actually have this week, Thursday, a webinar. So join us. It's free. Anybody can listen. And if you are busy and you can listen to the recordings, and Morgan can share about the office hours. That's the other great thing happens every month.
Yes. And before we move to office hours, I just want to say that webinars are open to everybody. I'm talking multidisciplinary clinicians. I'm really struggling with that word today. Family partners, hospital leadership. Anybody can benefit from these.
Small groups, but also large collaboratives.
Yeah, exactly. And so
And I actually would venture to say we've been talking a lot about culture change today. It's kind of a theme that actually you're more likely to move it forward if you really bring your whole, multidisciplinary team.
let us help you
Absolutely.
do the buy-in
Yeah.
for why family-centered care matters and why it's important. We've had really excellent speakers, families and researchers and clinicians, and we really invite you to check out our recordings and even attend this Thursday's webinar at 11 a.m. PT if you're available. Free to register, free to join. Everything we offer is meant to be accessible to everyone. We also have free office hour sessions where folks can come to FCC Task Force leadership. It's a really informal, casual conversation. It's not recorded. We've got usually 40 to 50 people on once a month. And you can say, my unit's really struggling with, I don't know.
The last month
anything.
we had improving mom's milk at the time of
Yes.
discharge. So we had a
Yep.
great conversation. How do you initiate in this antepartum area and a hand expression of colostrum? So how do you make sure they have a pump at the time of discharge? So people just discuss, and then it's just
Oh my gosh, we had folks talking about how they were able to establish a milk bank that's available to parents of term infants and preterm infants, and that it's covered by insurance even after the discharge from the NICU home. So then it's like all of these connections are being made within this 1 hour of just people having this open dialogue. And it's like, well, how can we do that in our own unit? Or how can we do that in our state? Or how can we do that in our country?
Almost like some of the things that are really beautiful about conferences. It sounds like you're distilling that into these office hours
Yes.
to help people start to get moving and thinking about how to make change locally in a family-centered way.
Yes.
it's true.
And I want people to know so they can go to your website, fcctaskforce.org/webinars, but fcctaskforce.org is the main site. The webinar this week, what a great lineup. It talks about the Butterfly Project, supporting families after co-twin baby lost. Professor Nick Embleton from the UK is absolutely wonderful. Kira Sorrells. I always say it wrong. Sorrells from the NICU Parent Network brings in so much like you said, lived experience to the conversation. And then Deborah Bueller as part of the NIDCAP team. So that's the cool thing about the webinar. It always includes a parent perspective. Obviously, that's your whole point. And the topics are super varied, and you have the whole library on your YouTube channel.
That's right.
So-
And our website, and I'm talking recordings, I'm talking slides, I'm talking other kinds of resources.
That's
So
also what people can subscribe so that they don't miss the opportunity
find us
for
on
the
social media,
webinars,
through our
the office
website.
hours.
Right on that homepage, you can join, you can register for office hours, you can follow us on almost every social media platform there is, and you can stay up to date on our work.
I love that. You said you guys are also presenting an abstract based off of the survey that you've done in the last, 6 to 9 months.
Oh my gosh. Yeah.
Yeah. So tell us a little bit about that.
Last October, we launched that survey.
Oh, yeah, a year. Wow.
Tell us about the survey.
Yeah. So, as I mentioned, the clinician was asking, we do this at family-centered care in our NICU. So we just wanted to ask this, are you truly delivering family-centered care? So how do we assess that? And so we asked our family partners, our executive council had 19 family partners. So we asked them, what's important to you? And what are the things that we can include in this survey? So we got 100 and 150 questions, but it's comprehensive. But we can't have 150 questions in survey, then we are not going to get any return response. So we have to narrow that down and got it around 66 questions. It focuses on 7 domains, And so we focused on a family infrastructure, NICU infrastructure and framework, and family integration into care, family integration into QI, and family support and process measures. So we is compartmentalized, we differentiated in the different domains.
Let me interrupt you. All of those domains and all of the questions were co-created by clinicians and family partners. I needed to add that. Continue.
And then each question has a score assigned to it. So then we distributed this to the clinical leaders and medical directors, or if you're passionate FCC providers, and you can take this survey and collaborate with your nursing colleague and collaborate with your team and complete the survey. So it's not a simple 5-question survey, I can just say that. And it's a comprehensive. We got a 99 centers. They actually took time to being part of this survey and completed the survey. And as a part of my grant, we actually got this qualitative interview to go in depth about their center's performance.
It's a mixed methods.
Yes. So we actually gave them a solution. Okay, so this area you're thriving well, but this area you're struggling. How do you get better? So we actually had a family partners, Mia Malcolm. So she actually interviewed the centers, and we actually collaborated. We gave them a solution. So focus on this section and work on this way and improve. And we are going to actually do this in 6 months and 1 year.
Check
and
back to
post
see.
interview and see how they are performing.
So this is beautiful, because not only are you creating knowledge, you know, you're describing the population, you're describing what's happening in our NICUs with respect to family-centric care, but your work, like the research, the data collection, is actually the catalyst for change within those centers, because by nature of having to answer the questions, I'm sure your respondents were learning about their own context. And then you intentionally did the second step of helping them address what they then learned were potentially problems in their own context.
So for example, one question is like actually stimulated the participant. Like we asked them, when one of the multiples discharge home, do you allow the other one to come back to your unit so they can stay as a family? And I was like, oh, we never thought of this.
Right now. And the parents don't ask.
Parents don't ask, and we never thought of it. Oh, how are you doing it? Can you give me an advice? So we gave the solution, and then they were like, okay, let me take this to the leadership team. See, they don't even aware of those things, and that's what we created.
And so now people can take that and do some advocacy for an evidence-based policy change around multiple
Exactly.
Yeah.
Here's how another unit did it. This is why we should do it. And this is how we can do it.
And this
based
is
on
what the data shows people are
Exactly.
doing.
Yeah.
I will put another plug in. The webinars, I feel like, are a lot of education, but a lot of logistics and technique. How do you talk to your C-suite?
Actionable.
How do you find the finding? You know, so like you said, every barrier is covered over the course of a year, practically, about how to overcome some of those impressive hurdles. Amazing work. Amazing work. We're running short on time. The one other thing we wanted to get to is talking about how conferences can engage family partners, and why is it necessary for the future of neonatology?
Well, I think that, as you mentioned before, families are the ultimate stakeholder, right? And so there should be nothing about me without me. And you know, I'm not given funds by my institution to travel to conferences, nor do I require what other folks might in terms of CME accreditation or things of that nature. And so I think that the biggest thing that conferences can do to make their events truly family-centered is to provide either a free or reduced registration rate for family partners, because it's really important that we're here. I feel like, you know, folks are always, you know, coming up to myself and my family partner colleagues like, wow, I hadn't thought of that before. Or thank you for speaking during this session, or thank you for bringing that question to my attention. And, you know, it's not just us who are getting something out of this, right? Like everybody benefits from having us here. And I love to see access.
I just wanted to add one thing. As a healthcare professionals, we can advocate for the family partners. And so when you are going to present your FCC-related work, invite your family partners. So invite them and reach out to the conference participant, and then see if there is any reduced discounted rate, or if they can give a free registration. So for example, I took my unit family partners with me to share our work to the medical directors retreat, and I reached out to the foundation team, we are presenting our work, and I'm just going to share this work to these medical directors, and I'm taking these family partners. Is it possible for you to just to sponsor her travel? And so I just asked, or it may work, it may not work. What's the worst thing can happen by asking? I just asked them. They said after checking with them.
I was going to say, I think what that comment really highlights is that asking the question to include presence of families in conferences, in presentations, even if they're virtual, even just asking the question both of conference organizers, but what I heard you say also is of your own institution, can be really policy changing, right? Because as us as healthcare providers, as professionals, as academics, as whatever other hats that we wear, start to question the status quo of us are being the only arbiters of the knowledge and the dissemination, suddenly a whole host of possibilities open up that you mentioned. So ask the question. We're empowering people to ask.
Well, thank you, ladies, for always showing us that it can be done. You just have to ask the question, push a little bit, and just remembering that. I mean,
Nothing about you without you.
nothing without you. Yeah, nothing about you without you, like you said. And to have the most optimal outcomes for babies, we need to have engaged parents, and to have engaged parents, we really need to better understand family-centered care. So thank you for all that you do. I hope lots of people will tune into the Thursday webinar this month and then in January.
Yes.
Okay.
Thank you both for the platform. Great work you're doing on the Incubator podcast.
Yeah.
Thank you.
Enjoy the conference.